What are my suggestions for someone who really wants a home birth but is nervous and anxious about complications? In many areas, there are also lots of home birth groups around your area, which will have experiences with local mums who have had home births. They are often led and ran by doulas and birth supporters and birth workers too, and sometimes they are even led by community midwives in areas. There will be other mums who will be able to share their home birth experiences, what their fears and anxieties were, and also be able to provide you their real life stories of having a home birth too. And all of the evidence shows that women who decide and plan for a home birth are less likely to have interventions, less likely to have an epidural, more likely to have a positive birth experience, and more likely to have a spontaneous vaginal birth than women who do not plan for a home birth. And just planning a home birth is the key point there, because many of these women still went on to have a hospital birth or a midwife-led centre birth. And that's because if you've planned for a home birth, you've set up for one, you've had these conversations with your community midwives, you've had your 36-week home birth assessment, for example, you might wake up on the day when you go into labour and decide, I don't feel comfortable here, I don't feel safe. You can change your mind. You can go into a midwife-led centre at that stage. You can go into a hospital. That's absolutely fine. But it's always far easier to plan for a home birth, set up for a home birth, and change your mind on the day than it is to wake up in labour and think, I'm really comfortable here and I actually don't fancy going into a hospital to birth my baby. It usually has to be planned in advance. And in terms of complications, these are managed really well here in the UK from a midwifery-based perspective. Your midwives will have prompt training every year that goes through the emergency skills and drills. Before becoming qualified as a midwife, student midwives have to do OSCEs every year. OSCEs are clinical-based emergency skills and drill sessions that they do every single year, and they are well versed in that. One of the recommendations from Ockenden was that newly qualified midwives shouldn't be able to go out into community straight away from qualifying. And so the midwives who go out to the community are experienced midwives who have done lots of delivery suite, birth centres sometimes, and ward-based and assessment unit-based placements. This means as a qualified midwife, they have had first-hand experience of managing lots of these emergency scenarios. And the chance of complications is lower in a home birth experience. There is no induction, so the chance of baby becoming distressed is at a lower chance. When things do arise during labour, either a raising heart rate, for example, that has been listened into by your midwife, maybe meconium, maybe there are signs of infection, maybe labour's taking a lot longer than what your midwife would have liked, they will recommend a transfer far earlier because they are starting to think the what ifs and actually recommending that transfer earlier than waiting until the last minute. And that's because they know that sometimes you need a bigger team around you as opposed to just your midwives. The most common reasons for transfer from the birthplace study here in the UK was a request for an epidural, that's not an emergency. Meconium, again, it's not an emergency, but it is something that would be recommended to transfer in for. And the other thing was slow progress too. Yes, there are still risks at a home birth, and that is why midwives at home births undertake your observations regularly, they listen into baby regularly, they also undertake a full holistic risk assessment every 2 to 4 hours depending on where you are in the UK to be able to just keep re-evaluating, is this safe, is this the right place, is the woman comfortable, and actually what am I predicting will be the outcome in this case. And midwives do carry equipment for other complications that may happen. For example, something like a core prolapse, far more common if you're premature, if you've got a breech baby, for example, if you've got twins. So really uncommon if you're over 37 weeks with a head down engaged low risk pregnancy. But if you were that one, they often carry things like Foley's catheters and also things that can actually fill that catheter to be able to help transfer in an emergency situation. And things like shoulder dystocia, for example, again, your midwives are trained in that every single year through prompt skills and drills training. It is part of our mandatory requirements as a midwife. In addition, many units also make sure that all community midwives have something called NLS training, neonatal life support training. That is an in-depth study day all about neonatal resuscitation, particularly out of home environments. And in some units, they have additional training that enables the skill set in out of hospital birth locations, emergency skills and drills training as well. And whilst I have been largely talking about sort of home birth and the mitigations that happen to try and improve safety for women and babies, it is just taking into consideration, where do you live? What are your ambulance transfer times like around your area? What's your relationship with your community midwifery team like? What are your thoughts? What is the things that is driving you behind having a home birth, for example? Home birth in the UK is largely safe and it is largely supported, and it does reduce the chance of interventions. It reduces the chance of needing pain relief. It increases the chance of a quick spontaneous vaginal birth too. Perineal tearing rates are much lower, breastfeeding rates are increased, but it is just being aware that home birth is not the right choice for every woman, and that's okay. But if you are unsure, have a conversation with your community midwife, find a local home birth support page, and like I said at the start, it is far easier to plan for a home birth and change your mind on the day, which is entirely your choice, than it is to decide when you go into labour, oh, suddenly I would really love a home birth.